Welcome to The Explainer. For decades, we've had this one universal medical mantra drilled into our heads. 120/80 is the absolute gold standard for blood pressure, right? We celebrate when we hit it, and doctors eagerly write prescriptions when we don't. But what if I told you that for older adults, aiming for that textbook perfect number isn't just unnecessary? It might actually be dangerous. Today, we're diving into some groundbreaking research that completely changes how we view blood pressure as we age. Because as it turns out, when it comes to your cardiovascular system, one size definitely does not fit all. So get this. A major study recently revealed a staggering statistic: 28%. Seniors who achieved that so-called perfect blood pressure of under 120 actually had a 28% higher risk of serious falls requiring hospitalization, compared to those with moderately higher numbers. We're talking about devastating, life-altering falls here. It turns out that aggressively lowering blood pressure in older age groups is actually causing a cascade of unintended harm. Here's our roadmap for the explainer today. First, the 120/80 blood pressure myth. Second, how aging changes your arteries. Third, finding your real sweet spot. Fourth, the 3-minute fall risk test. And finally, talking to your doctor. All right, let's jump right into the section 1, the 120/80 blood pressure myth. So how did we get this so wrong for older adults? Well, most of these guidelines were built for middle-aged people, basically assuming an 80-year-old is physiologically the exact same as a 50-year-old. But a massive study published in JAMA Internal Medicine flipped that completely upside down. They didn't just look at a handful of perfectly healthy subjects either. They tracked over 15,000 real-world seniors, including folks with diabetes, prior strokes, varying levels of frailty, for 5 full years. And what they found was truly shocking. The group that hit that textbook 120/80 target had higher rates of acute kidney injury, more fainting spells, and an overall mortality rate 14% higher than those with slightly elevated pressure. The absolute key takeaway here is that very low pressure is just as dangerous as very high pressure. Picture this scenario because it literally plays out thousands of times a day. An older adult is over-medicated to hit 120/80 while sitting calmly in the doctor's office. But when they stand up to go to the bathroom in the middle of the night, that pressure drops dramatically. Within seconds, their brain isn't getting adequate blood flow. The room starts spinning, they fall, and suddenly we're dealing with a fractured hip. Which brings us to section 2, how aging changes your arteries. Why exactly does this happen? Well, your cardiovascular system at 75 is fundamentally different than it was at 45. The first major change is arteriosclerosis. Think of your blood vessels kind of like a garden hose. A brand new hose is flexible, right? It expands easily. But a hose that's been sitting out in the sun for 20 years becomes stiff and rigid. Your arteries do the exact same thing as you age. When your heart pumps blood into stiffer arteries, they just can't absorb the pressure wave like they used to. Because of this stiffness, your body actually requires a slightly higher baseline pressure just to push that blood all the way up to your brain against gravity when you stand up. Now, the second piece of the puzzle involves baroreceptors. These are incredible tiny little sensors lining your blood vessels. When a 30-year-old jumps out of a chair, these sensors instantly detect the shift in gravity and tell the blood vessels to constrict, keeping the blood pressure completely stable. But as we age, these sensors get a bit sluggish. They respond much slower. So if an older adult's baseline blood pressure is already artificially pushed down by medication, and these sensors fail to instantly adjust when they stand up, the bottom completely drops out. And then there's the third biological change, medication metabolism. Simply put, an older adult's liver and kidneys just don't process and clear out drugs as fast as they did in midlife. A standard dose of a blood pressure medication that might be perfect for a 50-year-old will linger much longer in a 75-year-old system. It builds up over time, its effects become amplified, and it can dangerously crash their blood pressure levels far below what's actually safe. Okay, let's move on to section 3, finding your real sweet spot. So if 120/80 isn't the goal for seniors, what actually is? When we look at the real-world data, the optimal target, specifically your top number, the systolic pressure, actually shifts based on your age and functional status. For healthy folks between 65 and 74, the sweet spot for longevity is more like 130 to 140. For relatively healthy adults 75 to 84, it bumps up to 135 to 145. And for anyone over 85, or those who are frail with multiple conditions, a target of 140 to 150 might actually be the safest way to prevent falls and maintain quality of life. The older you get, the more that moderate elevation acts as a necessary protective buffer.
And while we tend to focus heavily on that top number, please don't forget the diastolic. That's the bottom number. This is the pressure in your arteries when your heart is resting between beats. For older adults, this should generally stay above 65 and ideally between 70 and 85. If your diastolic is consistently dropping below 60, even if your top number looks okay, that's a major red flag that you might not be getting enough blood flow to your heart muscle itself. Let's get practical with Section 4, the 3-minute fall risk test.
Now that we understand the physiological risks, you can actually run an orthostatic vital sign measurement easily at home using a standard blood pressure monitor. Here's the simple 4-step protocol. Step 1, lie down flat and rest for 5 solid minutes. Step 2, while you are still lying down, check and record your blood pressure. Step 3, stand up. And step 4, immediately check and record your blood pressure again while standing. Don't wait around, check it right then and there. And compare those 2 sets of numbers.
What we are really looking for here is what we can call the danger drop, medically known as orthostatic hypotension. If your top number drops by more than 20 points, or your bottom number drops by more than 10 points the exact moment you stand, you are operating in the danger zone. It strongly suggests your medication might be too strong and your brain is routinely being starved of adequate blood flow when you're upright. Trust me, this drop is often vastly more dangerous than having a moderately elevated sitting blood pressure.
Which brings us to our final and most important point, Section 5, talking to your doctor. You know, medical guidelines change very slowly, and many doctors are honestly still treating everyone to that old 120/80 standard. This is exactly why discussing personalized medicine with your doctor is non-negotiable. Individual health history matters way more than universal numbers. Look at these two 81-year-olds, for example. Let's say both come into the clinic with a blood pressure of 158/88. Patient A is frail with chronic kidney disease and osteoarthritis. Aggressively medicating them down to 130 could cause dizziness, a catastrophic fall, and even worsen their kidneys. A target of 140 to 145 is much, much safer. But patient B? They're a healthy, active golfer. They might just need some minor lifestyle changes or a minimal dose. Same age, exact same blood pressure numbers, completely different approaches based on their unique individual health profile. So how do you ensure you're treated as an individual at your next appointment? Simple. Don't go in empty-handed. Bring these 3 crucial things. First, a 2-week home blood pressure log where you track your numbers morning and evening. Second, bring the results of that 3-minute orthostatic standing test we just walked through. And third, bring a brutally honest symptom list. Are you dizzy, fatigued, experiencing random brain fog? Tell them. You are an active participant in your care, and bringing this data equips you to ask your doctor what target is appropriate for your specific functional status, not just your age bracket. Which leaves us with this final, absolutely essential question. Is your blood pressure target treating your age or is it treating you? The science is incredibly clear that universal numbers fail older adults. The sweet spot for longevity and a vibrant life is often a bit higher than we ever thought. So take those home measurements, look at your unique health history, and have that informed, empowering conversation with your medical provider. Empower yourself to ensure they treat the patient, not just the number. Thanks so much for joining me on this explainer, and remember to keep asking the right questions about your health. See you next time.